Welcome to our uncompensated and compensated ABG video lesson. In our previous videos, we talked all about what an ABG is, how we read an ABG, and how we also utilize our ABG tic-tac-toe board so we can determine what status or condition our patient is in, whether that's metabolic or respiratory acidosis or alkalosis. But there's still one thing that is missing that brings us full circle with our ABGs, and that is trying to determine when we read our ABG results if our patient's condition is starting to or trying to bring itself back to that homeostasis, that state of just normal or healthy that our body always wants to live in. So how do we determine this? Well, it all starts with that term compensated. So what exactly does compensated mean? When one system, like the respiratory system, moves in the opposite direction than the other system, like our kidneys, to help restore normal pH. So essentially, this is like our two systems saying, hey, I see you, I'm working on it, and I'm trying to help you out. So a great example of this is in our DK patients. We know that typically our DK patients are going to enter into metabolic acidosis. And why? Because we have this excess of ketones, and ketones are going to lower the blood's pH. Well, if we think about this, we normally see those Kussmaul respirations whenever we have a patient in DKA. And what are those respirations doing? Well, they're blowing off that acid or that CO2 rapidly. So we see them breathing super fast. That's because our respiratory drive is trying to compensate for all of that acid that's already going on, and it's trying to blow it off to help the kidneys out. So our lungs will hyperventilate to try to blow off that CO2. So when we look at this page here, we can see that we have compensated, partially compensated, and uncompensated. So let's talk about the difference between all of these and how we read it. Compensated is also really known as fully compensated. So if we have a compensated patient, we're basically saying that they are fully compensating and their body is bringing them back to that homeostasis. So compensated or fully compensated is going to mean that our pH is normal, but our problem isn't fixed yet. The kidneys and lungs are functioning together to maintain the acid-base imbalance, but this can change. So what would this look like on our tic-tac-toe board? So we're gonna set up our board like normal with our acid, our neutral, and our base. We can see here that our pH is a 7.35. So this is within range. A normal pH is the 7.35 to 7.45. So we're going to put it in that normal category. Our PaCO2, that carbon dioxide, is 61. Well, this is acidic, so we're definitely over that 45 mark, so we're pretty acidic right there. So we're gonna put our PaCO2 in our acidic range. And our bicarb, this HCO3, is a 30, which is gonna put that bicarb into a basic column. So in this tic-tac-toe, we pretty much are going to assume this is gonna be a respiratory acidosis, but we're gonna say it's compensated because one, we have a normalized pH or pH within range, but we also can see this bump now in that bicarb of a rate of 30 because it's trying to swing the other direction to counter or buffer all of that acid. So the biggest question here is, how do we actually know if the problem is respiratory or metabolic? Because essentially, we didn't really get a tic-tac-toe, right? Because our pH is normal. Well, the patient's condition is going to help us determine this, or their diagnosis is going to help us determine this. So when would we see something like this in our tic-tac-toe board? Well, this could be present in our COPD, our chronic obstructive pulmonary disease, because if we think about it, these patients are retaining a lot of CO2, right? And normally they're chronically doing this. So we might chronically see a little bit of a bump in that bicarb because it's actually really doing its thing by keeping that homeostasis and keeping that normal pH level going. So next is going to be our partially compensated. So this is going to be when our pH is still abnormal, but we're moving closer to our normal range. So if we look at this tic-tac-toe board, our acid, our neutral, our base columns, our pH is a 7.26, meaning our pH now has shifted below its normal range and into that acidotic range of a 7.26. Our carbon dioxide is basic. It's a 33, so we have a low CO2. And our bicarb is a 12, so it's now in that acidic column. So if we look here, we have our tic-tac-toe. So we know that this is metabolic acidosis, but it is partially compensated. So why do we get this conclusion? So yeah, our pH is a 7.26, and how do we really know if this is moving towards that normal range? Well, we can see that we have that CO2 is actually not a lot. We're low on our CO2. So what is that telling us? It means our body is hyperventilating. It's blowing off that CO2. This is that DKA that we were talking about with those Kussmaul respirations. So we're blowing off a tremendous amount of CO2, not retaining it. And this way, we're actually assisting our kidneys. So we can see that the body is in a metabolic acidosis, given our tic-tac-toe, but our carbon dioxide is starting to become alkalotic to help the acidosis, which creates that partial compensation. And lastly, we have our uncompensated. So this is when our pH is abnormal and really our body is either not responding or it just hasn't been enough time for it to even start responding. So if we look at these two examples, we have our first pH of a 7.17 that is going to be in our acidic range. We have a CO2 in our normal range of 43, and we have our bicarb at 19. So this is also acidic. So we have a tic-tac-toe right here. So this is going to be our metabolic acidosis, but we are uncompensated because our CO2 isn't really doing anything, or at least we know of yet. It's not showing us that it's trying to compensate for what's going on with the renal system. So our CO2 is normal, so it has not entered into a alkalotic state to help the acidosis of the metabolic system, making no type of effort or compensation. And in our second example, we have a pH again of a 7.17. So this is acidotic. We have a CO2 of 46 and a bicarb of 19. So all of these are going to be acidotic, which gives us a bigger than a tic-tac-toe. And this is going to be a combined acidosis with no compensation. We don't have anything in that normal range. Both systems aren't doing well here. And so our body is either A, not responding, hasn't had enough time, or we have too many things going on. So to fill in our blanks, the body is in an acidotic state and likely due to mixed disorders because our pH, our bicarb, and our carbon dioxide are all acidotic. This is uncompensated. And this concludes our compensated versus uncompensated ABG lesson. I'll see you in the next one.